All right. Okay, moving onward and upward. Today, we're going to talk about the respiratory system. Do you know why we're going to talk about the respiratory system? Because it comes after the cardiovascular system. See, I like the way I arrange this class because there's actually a method to my madness, believe it or not. I have a plan for your life. Did you know that? Wow. Doesn't that make you feel special? Stacy, I could tell. That was a for real, sincere head shake. That was. Oh. Okay. So, all right, we're going to talk about the respiratory. Did you print out the respiratory questions? That's beautiful. All right. So, watch. Here are the functions of the respiratory system. Do you ever look at these handouts? They got some good answers in there. Yeah. And then I go over it in class, too. And then you have a video. The only thing I could do to make it easier for you is to actually physically write out the test for you. That's about it. Everything else. They do? See? So you got to believe me. You guys are really in trouble. Okay, so watch. One of the big functions is to exchange oxygen and carbon dioxide. Now watch. You're going to have to learn some terms here. What does ventilation mean? Nice. Ventilation is moving air in and out of your lungs. Good. That's ventilation. What's respiration? That's ventilation. No, that's the respiratory rate. It's actually really a misnomer. It's really the ventilatory rate. So respiration is the physical exchange of gas. Now, better get this. There are two types of respiration. There is external, and that happens at the alveoli and the pulmonary capillary. And then you have internal respiration. And internal respiration happens at the systemic capillary and the cell. Tell me you got that. You're with me. Guys? Okay. And your hope is that external respiration matches internal respiration. So watch. True or false? When you exercise, your muscles need more oxygen and produce more carbon dioxide. So what do you have to do in order to accommodate that? You have to breathe faster and deeper in order to get more oxygen in and carbon dioxide out. See how this works? Now, a couple of other terms you have to be familiar with. Watch it. Who's watching? Anybody? Kids, you watching? Good. Hypoxia. What does hypoxia mean? Come on. Hypoxia. That's right. Hypoxia is low oxygen. What's ischemia? Lack of. Did you guys drink A&P juice before you came here? Are you really? What do you got in there? Right, that's lack of blood flow. Now, What I try to do is I always try to use like the simple language. You follow? Sometimes that's bad. That does you a disservice. Do you understand? Because then when you read the book, you're like, what he talking about? Willis. So hypoxia, ischemia. Now another term you have to know. Hypercapnia. Do you know what that is? That means you have, there should be an R in there. That means you have a big cap. Big cap. That means that you have elevated carbon dioxide in your blood. You got me. So hypoxia, hypercapnia, ischemia, internal, external respiration, and ventilation. See ya. Okay, now let's talk about the brain, shall we? You know, I was driving to school today, and I figured out that if people's IQ were based on how they drive, most of those people driving have an IQ of probably 40. I'm thinking. Yeah. All right, watch. What part of your brain controls breathing? What is it? What is it? No, I was just lighting that up. You were tricked. I didn't write that. Better write this down. The part of the brain that controls breathing is the medulla oblongata. The medulla oblongata controls breathing. There's also part of your brain stem called the pons. That's involved in preventing you from overinflating your lungs. But the primary center for breathing is the medulla oblongata. Now, watch. This is very important. Amber, is the amount of oxygen in the atmosphere by you different than the amount of oxygen in the atmosphere by me? Good. No, it's not. So we don't breathe because of oxygen. The primary stimulus for breathing in us is the buildup of carbon dioxide. Tell me you got that. All right. I want this whole thing. Don't you hate when I say that? Then you know it's going to be bad. All right. Ready? I'm going to make it real nice for you. What are the byproducts of metabolism? Good. That's very good. And many of those are potent arterial vasodilators, ain't that right? See how this is all working? See how this is all coming together? Okay, here we go. Watch. Here's a cell. How do you know it's a cell? I wrote cell. One of the byproducts of metabolism is carbon dioxide. Carbon dioxide is highly concentrated in the cell because it's a byproduct of cellular metabolism. Right? So where's the CO2 going to go? By diffusion. According to the arrow, it's going to leave the cell and go into the blood. Yeah. What's going to happen to the amount of CO2 in the blood? It's going to go up. Please get this right. Watch. Watch. What protects your brain and spinal cord? What is it? Cerebral spinal fluid. You got me? So here we go. So watch. Who's with me so far? You got the blood. Then you have cerebral spinal fluid. Cerebral spinal fluid is basically the plasma of the blood, right? When we get to the brain, I'll explain more, right? So now you have the medulla oblongata. You got me? Now watch. Are you with me? Embedded in the cells that make up the medulla oblongata, you're not going to believe this. These are called chemoreceptors. What do chemoreceptors recept? Heme. Are you with me? So watch. When CO2 from the blood builds up, it will diffuse from the blood into the cerebral spinal fluid. Are you with me? What's the cerebral spinal fluid made out of, kids? It's made out of water, mostly. And CO2 is going to combine with water. The equation you love to hate. And it's going to form what? You better get this right. Thank you. Carbonic acid. And carbonic acid is then going to dissociate, watch it, into hydrogen ions and bicarbonate ions. Are you with me? How many people are with me? And it is the hydrogen ions that will directly stimulate the medulla oblongata. So CO2 is an indirect stimulator of breathing. Directly, it's hydrogen ions. Say yes. So anything, watch it, anything that increases the amount of hydrogen ions in the blood through metabolism, a metabolic acidosis, is going to stimulate breathing. Say yes. You got me. Now, watch. Hydrogen ions have a hard time diffusing from the blood into the cerebral spinal fluid. They can do it, but not as readily as CO2. You got me? So the most powerful stimulator of breathing is carbon dioxide. And I want this explained. Say yeah. You got me. All right. Strike that from the record. If what she just said occurs on the tape, ignore it. It didn't happen. I don't know what you're thinking of, but don't ever say that. You got me? How many people are with me here so far? Okay. We're straight. All right. What I got to do now, how many people remember the anatomy of the respiratory system? Comme ci, comme ça. Assis, assis. One thing I'd like to point out with this respiratory handout is we have a lot of stars here. We have Glenn Close, a little aged Glenn Close. We have Tiger Woods with pneumonia. Tell me that don't look like Tiger Woods all day, right? Right, he's got pneumonia. That's probably why he ain't golfing so good. If he had a Z-Pack, he'd be straight and winning those tournaments. Can I tell you what bothers me about that? Let me tell you. Watch. Tiger Woods wasn't Joey Buttafuoco and then got married and became Tiger Woods. He was Tiger Woods before he got married. Do you understand that? So his wife knew exactly what she was marrying. She was marrying Tiger Woods. Do you follow that? That's all I have to say about that. Okay. Let's go, let's do a little respiratory anatomy, shall we? I hate to do this to you, but we have to. Oh, that doesn't work. What's the lining, the little saran wrap that covers the lungs directly, called? The visceral pleura. And then you have a thick, fibrous lining that covers the entire thoracic cavity. What's that called? The parietal pleura. Say yeah. You better write this down. Better not pout. Are you writing this down? Hang on, I gotta find a good one. Now we use Glenn Close. Watch. The parietal pleura lines the inside of the rib cage. You better write this down. And the parietal pleura is directly connected to the dome-shaped muscle that separates the abdominal cavity from the thoracic cavity, called the diaphragm. This is very important. This is very important. You got me? The visceral and parietal pleura of the right and left lung are separate. Do you follow this? It's not continuous. So you have the parietal pleura of the left lung and the parietal pleura of the right lung. So they're separate. Why is this a good thing? I'll tell you why. If it was continuous, where the visceral and parietal pleura were continuous, where they wrapped both lungs, if somebody didn't like you and they stabbed a knife in your chest and pulled it out, both of your lungs would collapse. But if they stab you in one side of the lung, only one side of that lung will collapse because the visceral and parietal pleura of both lungs are separate. Again, the body doing stuff that makes sense. The parietal pleura is directly connected to the diaphragm. Say yes. Okay, good. Watch it. How many people remember Boyle's Law? Come on, somebody. Come on. Kids? Yeah, there's Ohm's law, and there's the law of electroneutrality. I think that's it. Oh, there's Boyle's law, too. Come on. What? Yeah, pressure and what? Nice. Better write this down. Boyle's law deals with volume and pressure. And since this is the human body, I'm going to apply Boyle's law to the human body. Boyle actually said it. Boyle said that if you increase the volume of the thoracic cavity, where are the lungs? In the thoracic cavity. That will lead to a decreased pressure in the lungs. And where do things always go? High to low. Say yeah. Here we go. Okay, everyone can see this. Kids, can you see it? Watch. How many cervical vertebrae you got? 7. How do you know the 7th cervical vertebrae? It's a little knobby thing on the back of your neck. You got me? So watch, I'm going to impress you. 1, 2, 3, 4, 5, 6, 7. Say yeah. All right, now watch. Is the diaphragm smooth muscle, cardiac muscle, or skeletal muscle? What is it? No. Good. So what is it? It's skeletal muscle. So skeletal muscle can be controlled by the human body. True or false? Watch. Watch. I'm not going to breathe. Tell me you got that. So higher centers of your brain can override and cause you to not breathe or increase your breathing. Tell me you got that, right? But the part of the brain that controls carbon dioxide levels, the medulla, can override all of that. So if you have a real punky kid and they want the G.I. Joe with the Kung Fu grip and they didn't get it for Christmas and they say, I'm going to hold my breath, you let them. Because if they're punky enough to hold their breath until they pass out, the medulla will take over and start them breathing on their own. Watch it. When people go under the water, if they can't reach the surface before the medulla says you gotta breathe, they breathe water. That's how on CSIG or whatever that program is, they go, he didn't die, he didn't drown, he was killed and thrown in the lake because dead people don't breathe. So there's no water in their lungs. You see that? Say yeah. You got that. Okay. So, I want to show you this. Watch. The medulla brainstem, buildup of CO2, right? When those hydrogen ions from the CO2 stimulate the chemoreceptors, it will create electrical impulses in the medulla that will travel down the spinal cord. You better get this. And it will exit the spinal cord typically from cervical vertebrae 3 to 5. That nerve that exits the spinal cord, that innervates the diaphragm and causes it to contract, is called the phrenic nerve. The phrenic nerve, are you with me? That innervates your diaphragm. Say yeah. How many people are following this? So watch. If you were reading the textbook like this, right? You like reading the textbook? Yeah, okay. Right? And then, like a big boulder falls at you. And it falls on your neck, watch. People don't sever their spinal cord unless they are decapitated. Do you follow? When you twist your ankle, what does your ankle do? It swells. But the spinal cord, which is soft tissue, is protected by the tough vertebrae. So when you damage your spinal cord, it can't inflame outward, it inflames inward. And it will compress the blood vessels that supply the spinal cord, and if they're not, that inflammation isn't reduced, that area of the spinal cord dies. And the neurons within the central nervous system cannot be replaced. They don't have the ability to divide. How many people followed that? So any somatic function, muscle function, is lost below that injury. So if you have an injury above C5, you will not be able to breathe on your own. You will be a quadriplegic and you will require mechanical ventilation because you've lost the ability of the medulla to communicate with the phrenic nerve. Tell me you followed that. Yes? If you damage your spinal cord below C5 but above T1, You are a quadriplegic, but you do not require mechanical ventilation. So C5, still alive.
What was the second? What if somebody damages the C2? How does that work?
They didn't have any spinal cord damage.
Okay.
They're walking around. So you know what they do now for people who have spinal cord injuries? They take intrathecal iced saline and they put it into the cerebral spinal fluid and they have that circulate, because what does cold do to blood vessels? So some people with that intrathecal administration of iced intrathecal saline solution in the cerebral spinal fluid, they can reduce the inflammation and they can reduce the damage. Now watch. How many people have ever worked out or something and they haven't done it in a while? You ever work out? That day, it's not that bad. But it's a couple days down the road, right, that you feel awful. That's why when a patient has a spinal cord injury, right, the doctors will say, we don't know, we got to wait till the swelling goes down. And after the swelling goes down, excuse me, that will determine how much damage is left. So they can't really know right after the injury. And it's due to the inflammation.
You said that the nerve cells in there, once the blood presses on the blood vessels?
Right, the pressure moves inward and cuts off blood flow to that area of the spinal cord. And if you lack blood flow, you're ischemic.
And it's the nerve cells that can't reproduce?
Correct. The neurons within the central nervous system cannot repair themselves and reproduce. Nerves that are damaged in peripheral nerves, if you damage a nerve, it can grow again. It grows about 1 millimeter a month. Yeah, can I tell you a story about me? I was playing baseball and I ran into our second baseman, one of those fly balls in between, and I hit my back and it was jacked up. And this butt cheek was numb for about 2 years. And then that nerve grew back, and now I can feel my butt.
How was that?
I'm very happy about that.
Only one.
Tell me you followed that. You got that? Okay, so that's how it works. So with spinal cord injuries, with that knowledge of the phrenic nerve, you can look at a quadriplegic and immediately determine at what level their injury occurred. If they're on a ventilator or they're not. Yeah? Okay, so I explained why you breathe. That's the CO2, the C, right? Boom, right? Now I'm going to explain how you breathe. Because I think there's a question. Explain how and why we breathe. See? Always doing it. Man, I worked on my golf swing this weekend. Killing it. Guess what I was doing though? Did I tell you this? What my son asked me? He goes, Dad, why do you always practice your golf swing? I go, I want to get good. Vocabulary to the maternal, right? You want to get good at something, you got to work at it. I'm going to write that down. I'm going to go home and write that down. My buddy is one of these natural athletes where he just picks stuff up and can do it. I'm not. I have to work at it. So in order to beat him, I have to work twice as hard. But when I do beat him, it's very gratifying. Okay, here we go. What's connected to the parietal pleura? What is it? The diaphragm. The diaphragm, you better write this down. The diaphragm, when relaxed, is in a dome shape. Are you with me? When the diaphragm contracts, it flattens out. Are you following? So observe. Watch dude. Look. 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 Ain't that cool? So watch. So this is in the relaxed state. Hang on. Hang on. This is in the relaxed state. So it is dome-shaped. And what's connected to it? What's connected to the diaphragm? The parietal pleura. Say yeah. So when the diaphragm contracts, it is going to pull the parietal pleura downward, and when you pull the parietal pleura downward, it's going to elongate the lungs. So what's going to happen to the volume of the lungs? It's going to go up. So what's going to happen to the pressure inside the lungs? According to Boyle's law, the pressure inside the lungs will go down. And at that point, atmospheric pressure becomes greater than the pressure in the lungs. And where do things always go? High to low. So that's how you get air into your lungs. And most people who do not have respiratory problems breathe diaphragmatically. However, I have seen some students, when they see some questions on the midterm that they didn't get, they're like, they breathe using accessory muscles. Say yes. Now watch. You know what I had to eat today? Yes. No. That's close. That's very close. What? No. No. I had popcorn. Can you guys see? Look. Watch. Watch. You see this? Watch. See this? Watch. Watch. Get this wrong. I don't even want to talk about it. Are there muscles in between your ribs? What are they called? They're called the intercostal muscles. The medical term for rib is costal, right? Inter, between. So watch. If people have to get more air into their lungs, they will begin to use the accessory muscles of ventilation. Those are the sternocleidomastoid muscle and the intercostal muscles. Now watch. If you look at the way the ribs come off the spinal cord and connect to the sternum, they are downward. Tell me you got that. So when the muscles contract, right? When the muscles contract, they raise the rib cage up. They raise it up. So by raising your rib cage, what are you doing to the diameter of your chest? You are making it bigger. And when you increase the volume of your lungs, what happens to the pressure inside your lungs? It goes down. So the greater the difference between the atmospheric pressure and the pressure in your lungs, that means more air will go into your lungs. So when you have to get more air into your lungs, you will start using the accessory muscles of ventilation. Say yes. How do we normally breathe at rest? Like this. We breathe diaphragmatically. You got me? Now watch. How many people here have kids? How many people want a 19-year-old kid? I will sell them to you. I'll give you money if you take them. Watch. Watch. Any of your kids got asthma? He has hyperactive airways. Has he ever had a problem like pretty bad?
No, he just has an inhaler as needed.
Do you ever see when they're got real bad? When you have asthma, the bronchioles constrict. We'll talk about that in a minute. So if the resistance to airflow increases, what do you have to do to airway pressure in order to maintain airflow? You have to increase the pressure difference, so you have to make your lungs bigger. So at rest, these kids will start using the accessory muscles of breathing. So if your kid's laying there watching Teletubbies and his chest is heaving up and down, and his diaphragm is contracting massively, the diaphragm will contract so hard to try to increase the lung volume, they'll push their guts out. You ever see that? There you go. And these muscles, intercostal muscles, will contract so hard that you will actually be able to see between their ribs. That kid's in trouble. And you pick their fatty acid up, put them in your arms, and get their fatty acid to the emergency room, or they're going to be in trouble. Say yeah. Did you follow that? Okay. So that is how and why we breathe. So the primary stimulus for breathing in a normal, healthy person is the buildup of carbon dioxide. Say yes, and you're going to explain that equation to me. Are you with me? All right. All right, I'm doing this really quick. I'm doing it very quick because you had this in general, right? I can't do it all. I'm only a guy teaching at a technical college, trying to make futures. Watch. What's the respiratory lining like from your nose all the way down to your bronchioles? It's what? It's got mucus, boogies. You better write this down. The lining of the respiratory tract, number one, very, very, very vascular. What does that mean? Lots of blood vessels, arteries, right? So that's why lung cancer is so devastating, because it's so vascular, and one of the ways cancer spreads is through the bloodstream. Do you see how this all relates? Right? You ever get a bloody nose? Never had a bloody nose, ever. Never. That's ridiculous. Christelle hit her right in the nose, make it bleed. Tell me, you with me? It's also the cells that make up that lining are ciliated. Remember from the cell? What does cilia do? It moves stuff. Ain't that right? Yep. We're moving stuff. So here we go. Wait. I was watching Joey Bag of Donuts here, explaining shock. God. No. It's really bad. It's really bad.
The air that...
All right, so watch. Here we go. Here's the lining. And the cilia beat in one direction from the lower airway to the upper airway. You got me? And about every fifth or sixth cell that is ciliated, you have a cell called a goblet cell. And what do goblet cells secrete? Mucus. And the mucus rides on the cilia, like the Silver Surfer. And the function of the cilia is to catch bad stuff. I'm sorry, the mucus to catch the bad stuff. And then the cilia will beat from the lower airway to the upper airway. So when you're talking to somebody, yeah, this class sucks, I'm going to take it in Kenosha. And you swallow that goob in the back of your throat, that's your cilia cleaning your airway. You got me? Okay. Now, I'm going to answer another question for you. Do you know why? Because I am cool like that. Okay, watch. How many people know what cystic fibrosis is? You're going to do a lot better than that. All right. Watch, I'm going to explain something to you. I had this lady a couple years ago. She's a PA now in La Crosse. She goes, Tim, I impressed my professors when PA school because I knew the pathophysiology of cystic fibrosis. And I go, how does that benefit me? You know what I mean, Christelle? Like, how does that benefit me? So what? You learn something from me, but what's in it for me? Yeah? Why isn't this working? Sometimes technology sucks. And somehow my face got on that YouTube page. I didn't do that. That's the last, and I'm trying to get it off. Does anyone know how to do that?
Where is it?
I don't know. It looks like I have liver failure. It was in the summer and I had a tan. I kind of did. Hang on. Why isn't this working? Okay. Do you ever look at those videos I make? No, for real, do you? I'm going to take them off. Yeah. Yeah. Then you'll have to pay me like Joey Bag of Donuts. Only my information's good. You got me? Watch. This all relates. There is a law called the law of electroneutrality. Listen up, because this is true. The law states that the number of positively charged particles in the blood has to be equal to the number of negatively charged particles. And that the number of negatively charged particles in the cell has to be equal to the number of positively charged particles in the cell. Are you with me? Tell me you're with me. All right. People with cystic fibrosis have what? What is their problem? What's their problem? They can't breathe, right? That's their only problem, right? Okay. Now, what is their other problem? Every part of your body that secretes mucus is affected by cystic fibrosis. You got me? The most important is your lungs, because if you can't breathe, you can't come to Gateway. Are you with me? Now watch. I'm going to explain this, because there's a question about CF, the pathophysiology of cystic. Yep, now everybody's up paying attention now. Said no, yeah. You ready? When the goblet cell produces mucus, the mucus is very thick. You follow? Embedded in the cell membrane of goblet cells are these little ion channels called chloride channels. What's the charge on chloride? That's right. That's why I had you learn the 7 electrolytes and their charges. I'm always thinking. You got me? Where's chloride located? In a goblet cell. Are you with me? Embedded also in goblet cells are sodium channels. What does sodium have? What charge? Watch. What did I tell you about the law of electroneutrality? Right? The number of positively charged particles inside and outside the cell have to be equal. So when the goblet cell secretes mucus, chloride leaves through a chloride channel. Chloride is negatively charged. So What has to follow it in order to maintain the law of electroneutrality? Sodium. And what will follow sodium by osmosis? And anytime you add water to anything, you thin it out. Tell me you got that. In people with cystic fibrosis, there is a gene called the cystic fibrosis transduction gene. Where they do not make chloride channels in their goblet cells. So when they make mucus, that thick mucus, will chloride leave through a chloride channel? No. So if chloride doesn't leave, what won't follow? And if sodium don't follow, what don't follow the sodium? So what happens to the mucus? It's too thick, and the cilia can't move it. So the mucus starts building up into the lower airways, and bacteria be loving mucus. So they are prone to respiratory infections and ultimately respiratory failure at a very young age. And any part of the body that secretes mucus is affected by cystic fibrosis. Your GI tract, so they have problems with constipation and pancreatitis. They're usually infertile. They can't get pregnant because when they pop out the egg and the cilia on the fallopian, come on, Herman, they can't get the egg into the fallopian tubes because the mucus is too thick. Tell me, you got that. It was first isolated in the pancreas because you're not going to believe this. I'm going to show you. I'm going to show you that everything that I explained to you relates so that I can feel good about myself. So when people send me hate mail, I just ignore it. Watch. Watch how good this is. Watch how good this is. If you remember this, if you get this, do you remember this? Do you? Do you remember the GI tract from General? Do you remember this? What do you mean you think so? Watch. The gallbladder, the liver, and the pancreas all dump their contents into the duodenum. These ducts have goblet cells in them. Are you with me? Watch. So when the pancreas releases digestive enzymes, they release, just listen to this, amylase, which digests carbs, lipase, that digests fat, and trypsin, that digests protein. Are you with me? So when you eat some food, like I had some popcorn, yeah, that was good. The pancreas is signaled and it will release from its cells these enzymes, and they're supposed to go in to the duodenum and digest your food. But if you got cystic fibrosis, that mucus is really thick. So will those enzymes end up in the duodenum? They'll end up in the pancreas. And what are pancreatic cells made out of? You're not going to believe this. Carbs, fats, and protein. So amylase, lipase, and trypsin will begin to digest your pancreas. And it's replaced with scar tissue, cyst, fibrosis. That's how it was first identified. Do you know how good that is? That's why people with cystic fibrosis, they have to take pancreatic enzymes. Because if there's pancreatic enzymes in there, watch, that will feed back on the pancreas and prevent the pancreas from releasing those digestive enzymes. Did you know that? That's really good clinical stuff. Say yeah. They also have constipation problems. They have telescoping bowels, where if you were to remove part of a person's colon that has cystic fibrosis, you could see craters on the moon. The telescoping bowel. Are you following this? Can I show you something else? I was driving in today, and I was really hating on myself. You know, you ever have those days where you just can't stand yourself? You ever flip yourself off? Like you think of something that you did, and you're like, God, I can't believe that. You ever do that? Right? When I tell people that, they look at me like I'm out of my mind. I'm not. I don't like me. And I'm not really going to work on it either. I'm just not going to like me forever. So the fact that you guys don't like me has absolutely no bearing on my life. Watch. Anybody know anybody that was diagnosed with cystic fibrosis? Do you know anybody? You went to school with the girl? Guadalupe? They usually die before the age of 30, 35. Yeah, it's terrible. They basically suffocate. How they diagnose cystic fibrosis is a sweat test. Please get this right. What nervous system causes you to sweat? The sympathetic, right? So what they do is they give you a medicine. They inject it into your skin, in your forearm, called pilocarpine. Pilocarpine blocks the parasympathetic. So if you block the parasympathetic, what starts kicking in? And it will cause that area of the skin to sweat. Tell me you got that. Here's a sweat gland. Are you with me? Sweat glands go all the way to the surface of the skin, and you get sweat. Are you ready? Just so you know, no one else will explain this to you, and that is no joke. Maybe I won't. That's a sweat gland. What's that? Come on, two curved lines. Capillary. Embedded in the duct of a sweat gland are sodium and chloride ion channels. Are you with me? Watch. In people with cystic fibrosis, what don't they have in their sweat glands? So when they sweat water, there is also sodium and chloride. There's electrolytes in it. You know that, right? So when the sweat goes through the sweat duct towards the surface of the skin, the chloride usually gets reabsorbed back into the blood. But if you have cystic fibrosis and you don't have that chloride channel, are you going to be able to reabsorb that chloride? And if you don't reabsorb that chloride, you won't have to reabsorb the sodium to maintain the law of electroneutrality. So what will happen to the amount of sodium and chloride on your skin? It will go up. So the diagnostic test for cystic fibrosis is called the sweat test. Do you have any idea how good that information was right there? That's legendary. That is cystic fibrosis. Yes, it will be hot, very salty. I'm not even kidding. So that's how, and it's like, look, Oh, anyways, while I was hating on myself, I was thinking to myself, have you ever seen a doctor's care plan in the patient's chart? Have you seen that? Have you seen it like they have a diagnosis and then the doctor writes out what they're going to do? Have you seen that? You have? Do you see it routinely? Do you see that? I don't see it. But you're going to go into clinical and you're going to have to write nursing care plans, right? And do you know why you have to write them? Because you don't know what the disease is, so you have to write out a care plan and read what you got to do. Where if you know this stuff, you'll know exactly what to do, right? Okay, wait. The sweat test measures the concentration of chloride that is excreted in sweat. It is used to screen for cystic fibrosis due to defective CFTR channel, and the concentration of chloride in sweat is elevated in individuals with cystic fibrosis. Also, the chlorides are the sodium's elevated too. So that's how you do it. Give them color. There you go. Okay. All right. So that, ladies and gentlemen, is the cystic fibrosis and the lining of the respiratory. Very vascular, it's ciliated, and it has goblet cells. The goblet cells secrete mucus. The cilia beats from the lower airway to the upper airway to cleanse the lungs. Say yeah. You got that. Now, the function of the upper airway and the upper airway, you better know this, the upper airway goes from the larynx all the way up. So that includes the nasal cavity, the oral cavity, and the sinuses. So if a doctor says you have an upper respiratory tract infection, you may have a sore throat, or you may have a runny nose, or a sinus infection. Say yes. The function of the sinuses are, they're usually air-filled, but they have the same lining as the respiratory tract. So it's ciliated and mucus. Watch. So the sinuses have these little holes in them called ostia that allow mucus to drain into the back of your throat. The purpose of the sinuses is to reduce the weight of the skull and to provide resonance to your voice. You got me? Now, watch. If you get this right, I'm going to be proud of you. What does epinephrine do to blood vessels? That's beautiful. Okay? That's really good. When you get an allergy, I'm just talking here, just listen to this. Your immune cells release histamine. Histamine causes arteries to dilate. So if you have hay fever, right? What happens to your nose if the blood vessels in your nose dilate? And if the blood vessels get bigger, the nasal passages get smaller. So your nose gets stuffy. See? Yeah. If you take Claritin or Zyrtec or Allegra, it just prevents the immune system from releasing more histamines. So that's why you have Claritin D. What's the D? And don't say decongestant. What's the D? All right, let me ask you this question. Do you think it's medically necessary for someone with a stuffy nose to get a shot of epinephrine? Good. I think that's ridiculous. So what they do is they give you pseudoephedrine or fake epinephrine. What does fake epinephrine, Sudafed, do to blood vessels in your nose? That's the decongestant. Watch. Does it just constrict the arteries in your nose? That's why it says on the package, if you have high blood pressure, talk to your doctor before taking Sudafed, because it will constrict the arteries all over your body, and the resistance to blood flow goes up, and therefore your blood pressure goes up. No one will explain that. And you know what? The fact that I know no one will explain that to you makes me feel good about myself, because I know that you're getting a quality education sitting in this class. You think I'm lying, right? Who came to anybody here come to the Friday review? Yeah, my brother. I told you what happened, right? Ruzika, you came, right? There was a student of mine I had 2 years ago. Her name's Norma. She came to the review, and she didn't even have to be there. And she goes, Tim, anytime I'm in clinicals, I never go back to the stuff I learned from clinical, like in pharmacology. I go back to anatomy and physiology. She goes, Tim, I'm killing these things. I'm killing these classes. Her average in health alterations is a 96. You need 83 to pass. Right? So I say it unto you. Don't listen. But I'm going to feel good about myself, because I know that is rock solid. Do you see that? Oh. Okay, so that's the upper airway. Say yeah. Okay, what are the tonsils and adenoids? Good. Write that down. What are they part of? Say it real loud. The lymphatic system, and the lymphatic system is part of the immune system. So watch. Is there bad stuff in the air? Good. Pull my finger. Find out. So the adenoids protect your nasal airway. The tonsils protect your oral airway. Say yeah. Can you live without your tonsils or adenoids? Yes, you can. That's because there's a redundancy. You have lymph nodes, submandibular, supraauricle, and cervical lymph nodes. We'll get there later. Tell me you got that. What's the epiglottis, the function of the epiglottis? Right, you don't want to aspirate your food. So when you chew, like on, I don't know, maybe a Hot Pocket, num, 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 the soft palate pushes down, and the hyoid bone lowers to allow the epiglottis to cover the trachea, and your food goes into your esophagus. Say yeah. Okay, let's take a little walk through the respiratory tract. Better write this down, better not pout. As you move deeper and deeper into the respiratory tract, there is less and less cartilage. The trachea and main stem bronchi are made of cartilage. The lobar and segmental bronchus are made of cartilage. Cartilage strong, right? Diameter doesn't change too much. As you move deeper into the airways, you get to the bronchioles. The bronchioles are made of smooth muscle. And what are the two things that muscle can do? Contract and relax. That's right. So what really determines the resistance to airflow primarily is the diameter of the bronchioles. Say yes. You're with me, guys? Then you move into the alveolar duct, and then finally you have this sac of one cell thick membrane called, just read it, alveoli. Alveolus, singular, alveoli, plural. Like raviolius, the singular, raviolii, plural. You know what I think is kind of a funny name for a food? Beefaroni. Can I tell you the story just real? It'll take 2 seconds. I just got my CPR certification, so I'm a CPR instructor. So, and I only teach CPR classes at the company that I work for on Friday. So anyways, I had to teach a class, and they have this, the CPR dummies in the vault. They also work in manufacturing. Okay. Anyways, I'm going in to get the CPR dummies, and I see like 20 cases of beefaroni and Kool-Aid. I'm like, what's this for? And then the human resource lady's like, well, Tim, if like we get a snowstorm or a bad storm, we got to have something for the people to eat, and if it's bad weather, they ain't going to be delivering, so we have like, these cans of beefaroni and like Dinty Moore stew. You know what's really good? And people like badmouth it, but Hamburger Helper, I like that stuff. Yeah. Like the lasagna ain't bad, or the macaroni and cheese, you know, that ain't bad. Yeah. So there. And Hot Pockets, telling you. So that's raviolius, ravioli. You ever look at SpaghettiOs? That's got cancer written all over it. I mean, the color of those things is like, that's cancer. People eat that stuff. All right, tell me you got that. All right, if you, I'm not even going to explain it. You should know this. You should know it. Is it watery in the alveoli? Yes or no? Is it moist in the alveoli? Okay. We went over it. We went over it. What doesn't a fetus do that you do? Breathe. So the alveoli in a feti are collapsed. Tell me you got that. So when the baby comes out, the doctor slaps him on the butt and they're, what the? You got me? They will expand their alveoli. But watch. Because it's moist, ain't that right? It's moist, right? Because it's moist, when they blow the breath out, the alveoli tend to collapse and the walls tend to stick together. Tell me you got that. Do you want that to happen? No. So inside the alveoli, the lining of the alveoli, are specialized cells called type 2 alveolar cells. And they secrete a substance called surfactant. And surfactant prevents the water molecules from sticking together and prevents the alveoli from collapsing and sticking together. But babies feti don't typically make that until about the 7th month of gestation. So just so you understand, and don't ever say this, because if I hear you say it, and even if I'm 90 in a nursing home, I will go to the gateway server and I will change your grade to an F. You got me? The lungs of a fetus are developed. They just lack surfactant. So if they know a baby's going to be coming early, they can actually give the mother a synthetic form of surfactant called surfactant. Or if the baby, they don't know it's coming early, the baby pops out, they can give them surfactant down the ET tube so the baby's not on the ventilator for a long time. So babies that were born very, very small, like 1.5 pounds, 2 pounds, right, they were born at like 6 months, they never had a chance. But now because of pediatric ventilators and the advent of that surfactant, those kids can, they can make it. And they can grow up to come to Gateway and not read the textbook too. me you got that, guys. All right. So please get this. It is in fact at the level of the alveoli, and every alveoli has associated with it a pulmonary capillary. And this is where external respiration takes place. Tell me you got that. You're with me. You're following this. All right. Go ahead. Take a break for a minute, and then I'm going to finish up some of this stuff so we can knock this out. Great. How many people got that? The little trip through the respiratory tract? You got me? All right, here we go. Please get this right. You had chemistry. What's the pressure of the atmosphere in millimeters of mercury? Nice. You got me? What's the atmosphere made out of? What? Nice. Did you read or something? Did you really drink A&P juice or something? There you go. It's made out of nitrogen. And what else? I'll tell you. Oxygen and a little bit, very, very tiny amounts of carbon dioxide. Very small. It's negligible. So there was this dude named Dalton, and Dalton came up with the law of partial pressures. Dalton stated that the total pressure of a gas mixture is equal to the sums of each gas's partial pressure. Can I break that down for you? Is that okay? Watch. What's the total pressure of the atmosphere? And 79% of the atmosphere is nitrogen. It is like many of our students here that I have in my classes. It's inert. They don't do anything. All they do is take up space. Nitrogen is that's a slam, just so you know. Nitrogen is inert, so all it does is take up space. Oxygen is the remaining part. So watch. What is the total pressure of the atmosphere? What is the partial pressure of nitrogen? Meaning of the 760, what is nitrogen contributing to it? And that's 79% of 760, which is 600 millimeters of mercury. You got me? What's the partial pressure of oxygen? Come on. Do the math. Thank you. 160 millimeters of mercury. Tell me you got that. So watch. When you talk about oxygen in the atmosphere, or oxygen dissolved in liquid. Can you dissolve a gas in a liquid? What makes the pop pop? Carbonation. What's the carbonation? CO2 dissolved in the pop. So can you dissolve a gas in a liquid? Good. Now watch. You better write this down. I'm not writing it down. The amount of oxygen or carbon dioxide dissolved in the plasma of the blood. Did you write that down like that already? You got it? Is measured as a partial pressure. The amount of oxygen oxygen or carbon dioxide dissolved in the plasma of the blood is measured as a partial pressure. And it is abbreviated PO2 for oxygen and PCO2 for carbon dioxide. Have you ever seen these terms before?
Yes.
There you have it. So that's the amount of oxygen and carbon dioxide dissolved in the plasma of the blood. And it's measured as a partial pressure. Say yeah. No coughing. No, I tore my bicep. Reading a textbook? I don't know. Actually, I don't. Okay, watch. What's the PO2 of the air in the atmosphere? Good. Can you blow out all of the air in your lungs? Good. If you did, you could use that as an excuse. Tim can't come to class. My lungs are collapsed. I blew out all the air. Even though I knew I wasn't supposed to. Did it anyway. So is there a certain amount of air left in your lungs, even when you try to blow all that air out? That air that you can't get rid of in your lungs is called the residual volume. Are you with me? And the residual volume, the amount of air left in the airways, because you can't blow it all out, has a PO2 that's very low, about 40. Tell me you got that. Are you with me? Residual volume, the amount of air left in the respiratory tract after you blow all that air out, it has a PO2 of 40. So when you take a breath in, and you're taking that breath in with a partial pressure of 160, it's mixing with the residual volume that's left in there. You got me? You're following this. So by the time that air gets down to the level of the alveoli, that PO2 is 100. So what's the PO2 of the alveoli? It's 100. Because the air that you were breathing in had a partial pressure of 160, and it's mixing with the PO2 of that residual volume. And if you average that out, it comes out to about 100. So the PO2 in the alveoli is 100. Say yes. You're with me. All right. Better write this down. Better not pout. Please get this. Bronchial alveolar duct alveoli. You with me? Every alveoli has associated with it what? A pulmonary capillary. You follow? What happens to the amount of blood returning to the right side of the heart when you're exercising? Right. It goes up, right? Everyone, because what are you doing? You're contracting more muscle, right? So if you're contracting more muscle, you're going to produce more carbon dioxide, say yes, and you're going to need more oxygen. Yes? How were you breathing before you started exercising? Now you start acting. So you're breathing faster and deeper. Watch. Write this down. Oxygen in the alveoli is a massive arterial vasodilator. It is just the opposite of what happens at the level of the cell. High levels of oxygen at the cell cause blood vessels to constrict. It's low levels that cause it to dilate. But you want to be able to get more oxygen into the pulmonary capillaries, right? So, if you ventilate more alveoli, you will start opening up those pulmonary vessels so that you can get more oxygen in. Tell me, it's very important that you get that. How many people got that? So, if you're only ventilating this alveoli, let's say, are you getting any oxygen into this alveoli? So these blood vessels are going to be constricted. So when the right ventricle contracts, what vessels is it going to send it through? Here, because they're open and blood always takes the path of least resistance. Say yes. So this is what's called the ventilation perfusion balance of the respiratory tract. Normally, you will only perfuse alveoli that are ventilated. If you're not ventilating an alveoli, is there any reason to send blood to it? Body does stuff that makes sense, so it don't. Tell me you got that. Guys? Okay. Here we go. I'm going to leave here. I'm going to feel real good about myself. I am. Because I know this is good. Write this down. There are two ways oxygen is transported in the blood. What's one of them, kids? What is it? We don't know about that yet. Oh, that's the same thing. I just explained it to you. You're just saying words, huh? What's blood made out of? Now, if we learn more, right? Do you remember this? That was like from day number 1. Never forget it. It was a Monday. Plasma. Can gases be dissolved in the plasma? Here's looking up your old address, right? If carbon dioxide can be dissolved in water, can oxygen? Good. What's the PO2 of the alveoli? That's right. Are you constantly replenishing that oxygen in the alveoli? Yes, because you're constantly breathing. At least you hope you are. Just take this on faith right now. The PO2 of venous blood is going to be higher or lower than the PO2 in the alveoli. Why? Because you want the oxygen to move from the alveoli into the pulmonary capillary to oxygenate that blood. Ain't that right? So the PO2 of venous blood being pumped by the right ventricle is 40 millimeters of mercury. And where do things always go? high to low. If you don't know an answer to a question, just write high to low. You got me? Now watch. Oxygen will move by pressure from the alveoli into the pulmonary capillary until the pressure of the alveoli and the pulmonary capillary are equal. And because you are continually replenishing that oxygen, the PO2 is going to equilibrate 754 and bringing you equilibrate. The PO2 of the plasma is 100 millimeters of mercury. Do you follow that? So you are continually applying that pressure to the capillary and the blood until the pressure of oxygen dissolved in the plasma and the capillary is equal to the pressure in the alveoli. Say yes. How many people follow that? This blood that now has a PO2 of 100 is going to go to what side of the heart? Left atria, mitral valve, left ventricle. Out the aorta and to where? The cells of the body. And we learned, I will never forget it, it was a Wednesday. We learned that there is an arterial end of the capillary, and a venous end. Do you notice how I made the A red and the V blue? I said it to you the first day. I know I did. Where's the only place that nutrients and gases are exchanged? So if you wanted to figure out how much oxygen was being transported in your arteries, would you have to stick a big needle in your left ventricle? Because if you stuck a needle in an artery, no gases have exchanged until they get down to the capillary. Tell me you got that. So the PO2 of an artery would be equal to the PO2 of the blood being pumped by the left ventricle. Say yeah. That's why when they do arterial blood gases, they don't have to stick a needle in your heart. Like that one, huh? What's the PO2 of arterial blood? I heard 140. Whoever said that, get out. It's 100. You got me? Right? What's the PO2 inside the mitochondria? What do you mean? Well, where do you want the oxygen to go by pressure? So do you want the PO2 inside the cell to be higher or lower than the arterial blood? So the PO2 inside the cell is 40. You got me? And oxygen will move by pressure from high concentration or high pressure in the capillary to low pressure in the cell until the pressure in the cell and the capillary have equilibrated. That's why the PO2 of venous blood is 40 millimeters of mercury. And where do all the veins of the body dump their venous blood? And that blood then goes to the right ventricle, gets pumped into the pulmonary arteries, arterioles, to the pulmonary capillaries. And what's the PO2 inside the pulmonary capillary? What's the PO2 inside the alveoli? Say yeah. One of the ways that you transport oxygen in the blood is dissolved in the plasma of the blood. And it's measured as a PO2. Say yeah. Can I explain to you why that's important clinically? Anybody have dreams of working in an emergency room? You want to work in an emergency room? Okay, good. All right. Are you ready? If somebody comes in and they're bleeding their own blood, it's fertiliting out of them. Can you look at that blood and say, that's a negative all day? You can't? If you give somebody the wrong type of blood, is that a good thing? No. Good. I'm writing that down. Just so you know, if you do give a patient the wrong blood type, you're going to have to practice these words. Would you like fries with that drink? Because they will fire you so fast, it's not even funny. Because if you've ever seen a nurse have to give blood to a patient, it is they have to give up their firstborn, right? Check and recheck. Tell me you got that. So if you screw that up, you in trouble. So because patients have different blood types, they're bleeding that blood, and it takes time to type their blood and then to cross-match it with the donor blood. In the meantime, the person is dying. So you just update your Facebook status, right? But watch. You learned today that there's another way to transport oxygen down to the cells in the blood. And that is what? Dissolved in the plasma. And plasma, that's why I have it here, is what? So you get big old IVs in them, and you start injecting saline into them, and then give them 100% oxygen so you can maintain their blood volume, stop their bleeding, and until you can get their blood type and crossed. Say yes. You got it. That's why it's important. PO2 inside what capillary? Pulmonary capillary? It's 40. The venous blood. Right? Venous. I'm writing it down. Venous. And then, when it meets with the alveoli, pressure moves it in until the PO2 is equal. So that becomes arterial or oxygenated blood. And all that blood now goes to the left side of the heart, boom, down to the cells. Say yes. That's 100. Say yeah. So what's one of the ways that oxygen is transported in the blood? Dissolved in the plasma of the blood. Say yeah. Okay, here we go. We're doing good. We can probably have the respiratory quiz along with the cardiovascular quiz. Yeah, we're killing it tonight. These people are missing it too, and I forgot to record this. They're missing out. This is really hard stuff. You know what I found too is that when you record this stuff, it takes away people's incentive to come to class. I noticed that. That's good. So I don't have to deal with it. I'm going to try to put this class online. Okay, here we go. The best way to transport oxygen is attached to the iron in hemoglobin. How many people have a hoopty? You got a hoopty? Borderline hoopty? A hoopty is a puddle jumper, a jacked up vehicle. How many people have ever seen the movie, what is it? Beverly Hills Cop, the original one. That was my car, his Nova. That was a 1974 Chevy Nova. Loved that car. anyways, that's a hoopty. When you get paint chipped off your car, there is iron in that metal. And the oxygen will bind to the iron and it will make it rust colored. That's why our blood is red. Because when oxygen binds to the iron, it turns it red. Spock has copper in his hemoglobin. That's why his blood is green, Christelle. Did you know that? Yeah. You got me? Now watch. Inside a red blood cell, even though it's yellow, you have a big freaking protein, and it looks exactly like this, called hemoglobin. And embedded in the heme portion of the hemoglobin are 4 atoms of iron. Are you with me? Guys? Who's with me? And each atom of iron is capable of holding 1 molecule of oxygen. So how many molecules of oxygen can 1 molecule of hemoglobin carry? Did you do the math in your head? Good. Here's an interesting fact. You better write this down. Each red blood cell has, on average, 250 million molecules of hemoglobin. So 1 red blood cell can carry a lot of oxygen. And it is oxygen that is bound to the iron on hemoglobin that is the best way to transport oxygen down to the cells of the body. 98% of all oxygen is transported bound to the iron on hemoglobin. So anything that causes you to bleed and lose red blood cells is severely going to diminish your ability to deliver oxygen to the cells of the body. Can you see that? Please get this. What's hemoglobin? What's it made out of? Remember, it's protein. And I told you that proteins, structural or functional, Kristen, remember, I'll never forget it. It was Wednesday. Are temperature and pH sensitive. Didn't I tell you that? And that if you alter the pH or alter the temperature, you will change the shape of hemoglobin. Say yes. That's beautiful. How many people got that? Now, how many people have take vital signs at work? The reason you take vital signs is they are vital. You need them. Watch. Have you ever had to take a person and put the little fingy clip on them? What's that called? A pulse ox. What are you measuring? Oxygen saturation of what? Well, I'm going to have to explain that one to you. What are the 2 ways that oxygen is transported in the blood? And? No, you're right. I gave you kind of a surprised look. I know, you're right, because it came out of you so, like, all natural. You've been drinking A&P juice? Maybe that Crunch Bar. Maybe it's got something else in it. Who cares? Watch. When you put a pulse ox on somebody, you are actually measuring the amount of oxygen bound to the iron on hemoglobin. You follow? Now this is important. And you're measuring the arterial saturation. So when that blood, this red blood cell, and all the red blood cells that are coming from the right side of the heart go through the pulmonary capillaries, 96 to 98% of all the iron in all the hemoglobins of all the red blood cells should have an oxygen bound to it. So that's why you get a little pulse there. The pulse acts, right? And then it will give you a percent, right? Well, it's not perfect, right? Though, just like an AccuCheck, it's not like, there's some variance. You can never get 100% saturation of a red blood cell. The reason you can't is because some of the blood that's in the right ventricle is diverted to feed the lung tissue itself. It is called the pulmonary shunt. So some of that venous blood goes to the lung tissue itself and does not participate in gas exchange, yet mixes with the oxygenated blood in the left ventricle. That's why you can never get 100% saturation of blood. That was an extra credit question a couple of semesters ago. Clearly not now, because I just gave you the answer. But you probably weren't paying attention, so maybe it could be. Were you updating your Facebook status, Crystal? How many people got me there so far? All right. So what's the best way to transport oxygen in the blood? That's beautiful. All right, now watch. If you get this, we're going to end this mess early because we did good today, didn't we? We did real good. All right, watch. Where in the body do you want oxygen to bind to the iron on hemoglobin? In the lungs. Where do you want the oxygen that's bound to the iron on hemoglobin to let go? Tell me you got that. What I have just explained to you in layman's terms is the oxyhemoglobin dissociation curve. I've just given you just a little broadcast there. But what they're trying to explain to you in your book is, how does oxygen know to bind to the iron in the lungs? And when it gets down to the cell, how does oxygen know to let go of the iron and go into the cell? Say yes. You got me? Okay. So watch. Just so you know, oxygen does do that. It binds to the iron in the lungs and lets go when it gets down to the cell. Say yeah. Okay. If you want to see a dead person who will never look healthier in their life, see a person who has succumbed to carbon monoxide poisoning. Have you ever seen that? They look so healthy. They got little rosy cheeks, but they did. So I'm going to explain to you now how carbon monoxide kills you. Carbon monoxide, lighter than air, heavier. I don't know either. Well, let's find out. When guys worked in the mines, they would have carbon monoxide building up. So they would have birds in cages hanging up. So if the bird fell over dead, they knew carbon monoxide was building up, and they better get their fatty asses out of there. So is it hot? Is it lighter than air or heavier? It's lighter than air. Tell me you got that. So if you have people upstairs in your upstairs bedroom that are dying, and you're downstairs, get out of there. Say yeah. So watch. What's this? Chemistry. What's this? Carbon monoxide. Carbon monoxide is a deadly gas that's produced through the combustion of fossil fuel. That's my public service announcement. So, using space heaters that are fueled with like kerosene, You got me? Or a car engine. You got me? So a couple of years ago, there were two people that they wanted to have sex in their parents' house, but the parents wouldn't let them. So and it was wintertime, so they went into the car in the garage, turned the car on, but didn't open up the garage door, and they were found dead. I think they were like 45 and 46. See, they were living in their parents' basement. Okay, so watch. Carbon monoxide, colorless, odorless, so you don't know what's happening to you, competes with oxygen for the binding of iron. If carbon monoxide wins, oxygen won't bind. Tell me you got that. Here's the thing. When carbon monoxide binds to the iron in the pulmonary capillaries, when it gets down to the cell, it don't let go. Tell me you got that. So every time that blood is recirculated, it will bind to another iron. And that means less oxygen can bind. So what's going to happen to oxygen delivery to your cells of your body and your brain? It's going to be cut off. So you get asphyxiated. That's how you die. And if it's done slowly over time, like people don't know it, they fall asleep and they wake up dead. But carbon monoxide, when it binds to iron, turns the blood red. But because it doesn't let go, when people are dead, they have this nice rosy color to them because their blood looks like it's oxygenated when they are full of carbon monoxide. Say yeah. Now watch. What's the PO2 of the alveoli normally? It's right here. Good. Now watch. And this happened. There was a guy, he always sat there a couple years ago, and a girl came in and sat there. So he started doing this. I'm not even kidding, walking back and forth, right? So I'm like, there's going to be a fight. Now watch. If somebody's sitting in your seat, you don't like it, and they're ignoring you, you can push them. You got me? But if they don't move, then what do? Right, you push them even harder. Tell me you got that. So when a person is exposed to carbon monoxide, you have to elevate the pressure, the PO2 of oxygen. So when somebody comes out, you'll see the firemen on Channel 6 News. The person is exposed to carbon monoxide, they put an oxygen mask on them because that increases the PO2. Tell me you got that. But if that ain't enough to get the carbon monoxide off the iron, then they put them in a hyperbaric chamber where they crank up the PO2 to 6 or 7 times normal, and that forces the carbon monoxide off the iron. Then the carbon monoxide is exhaled. Tell me you got that. And they need to be alive. Or you can do that. But that's how it works. Tell me you got that. That's how carbon monoxide. Now look, on Monday we're going to finish up this respiratory stuff. I'm telling you right now that I'm going to go over the oxyhemoglobin dissociation curve. That question, how I phrased it, it says, how does oxygen know to bind to the iron on hemoglobin in the lungs and let go when it gets down to the cell? That's like a 350 pointer, right? It's huge. And I also, not going to believe this, there's a video that I made called the oxyhemoglobin dissociation curve. But don't look at that. It could only help you. Say yeah. Okay. We can ambulate home now. You know what? I think a button fell off my
It's
pants.
right there on the floor. I thought it was too.
That's mine, right? Yeah, it broke off right here.
Hopefully your girl can sew.
No, I'm gonna staple it. All right, guys. Work hard for that cardiovascular.